So let's go ahead and take a look here. You can already feel it's real sensitive there? Okay. All right, real quick. So I know you said that the lower back has been really bugging. I know you said it really got real bad yesterday.
Yeah.
So what's going on here? So in terms of what you're feeling, in terms of it's getting worse, what is it feeling?
It's like a sharp pain, and I feel it more on all of my right side.
Okay.
And if I try to, like, if I don't sleep correctly, it'll pinch.
It'll pinch.
So it's like not only is it sore or hurting or aching, but it's like also that little pinch where it's like, okay, you need to move.
Like that sharp pain.
Yeah.
Okay. Now, in terms of like the pain, is it going down into the knee or down into the feet, or is it just kind of into that?
It's just there. Yeah,
right
just
into
right
this
here
area?
in this area.
Okay. Are you feeling it into the back or more on the top?
Into the back.
Into the back, down to the glute area.
Mm-hmm.
Gotcha. Okay. Is that different from what you first told me?
No,
That's
it's just gotten worse.
It's just increased it.
Yeah.
Okay. All right. Yeah. Okay. And are you sleeping on your stomach, on your side, or on your back?
I sleep mostly on my side. If I end up moving, I move more towards this side. With the pain now, I shift between both sides.
Okay, gotcha. The pain's been going on, you said, months, right? Or
yeah, it's going on for years, but now it's gotten way worse.
Okay.
I feel like the past couple of, like easily like a month, it's gotten a lot worse.
Really?
Mm-hmm.
Okay. Well, I'm glad you're here. Let's see what we can do for you. Alright, so we're just going to scope your spine, checking you out, see how things are doing here. Go right there. Alright, we're probably going to be working on this upper back. That thing's just shooting over to the side here. Yeah, you guys are too young to be experiencing all these things going on. Yeah, that's where we're starting. Yeah, you can feel that, right?
Yep.
Yeah, that's just real sense right there. Okay. What you actually have is what's called a grade 1 spondylolisthesis. I didn't really talk about that much just because it gets a little too overwhelming. But in terms of that L5, you actually have it where that joint, it slips forward, okay? Now, the thing, and this is one of the biggest reasons why we take x-rays in our office, is because when that joint, it shifts forward. Without taking x-rays, I would never know that. But if I was to adjust that and push it even further forward, I don't want that to happen because that can get really aggravated here and sometimes make it worse. Okay, so thank goodness we're taking the x-rays, because what we're going to need to work on is probably going to be on that pelvis and that sacrum, okay, to scoop that underneath that. So in terms of what I want to check on is real quick just the movement of that joint to see if I'm going to work on that sacrum or if I'm going to work on the pelvis. Okay, so let's go ahead and take a look here. You can already feel it's real sensitive there. Okay, and then I'm going to push right here is S1. S2, and then S1. Any soreness in those?
One.
I'm going to tilt you back just a little bit. Yeah, that doesn't dip the way it's supposed to move there. And then I'm going to push onto that pelvis here as well. There's the upper joint, middle, and then lower.
Middle.
Yeah. Okay. Do you find like you're having more pain when you're sitting or when you're standing or
when
walking?
I'm sitting.
When you're sitting?
Yeah.
Okay. Yeah, I know when I was talking to you earlier, you were pretty much leaning over to the side.
Yeah.
Okay. Okay, yeah, we're going to be working on this right over here. That's going to be your tailbone. That's the one we're going to be working on the most. And that's where that mark, where that needle just shoots over to that right side because it's really swollen there. All right, so let's take a look here. 1, 2, 3. So here's T3. T2, T1. 1, 2, 3. Any soreness with those?
One.
Yeah. Okay, I think those are going to be the first two that we're going to work on today, is that T1 and then that base posterior sacrum, that tailbone of yours, okay? And as you relax your right shoulder, you're just going to look up just a little bit. Okay.
That came out of me? That's a crazy noise.
What did you say?
I said that came out of me? That's a crazy noise.
Yeah. Well, that was good. Your head's still attached? Okay. So now we're going to go ahead and work on that tailbone. And I know we're having a lot more symptoms on that right side, but we're just going to work right into the center of that spine, right down on that tailbone here. And the way we got to do this is I got to scoop that underneath that L5 for you. Okay. So let's relax this leg just like that. And as you do that, I'm just going to scoop that underneath that just a little bit. And again, you might feel a little bit of a popping noise, and you'll be just fine, relaxing right there. Drop. No? Okay. Coming up, I want to see if I can get a little bit more on that. So have a seat. Good. Okay, good. All right. Coming up. All right. Okay. Good. Good. All right. So just with that, noticing any difference in here? Any stiffness or any soreness, or are you feeling pretty good?
I'm feeling pretty good. It's not. I still feel like a little sore, but it's not as bad.
It's not as bad? Okay. Let's take a look at the neck here. Good. Yeah, so it's reducing quite a bit down here. Good. So now that we got some movement on there, now that we got the joint to start moving the way it's supposed to, now the next thing that we got to start doing is doing some walking. Okay, as we start walking, because this joint's moving now, walking's going to help to push out some of the inflammation and the swelling. So there's still a lot of swelling in here. So what we're going to want to do is walking and then also ice. Okay. As you do both of those, it's going to help to, basically ice is a vasoconstrictor. It'll actually push out any of the inflammation in there. So 20 minutes every couple of hours if you can. But then with the walking, with the ice, that's going to start to feel a lot better. Okay. All right. So in your spine, we worked on that T1 over here. Okay. Now, that's the one at the base of your neck. You can see how it's lost that curve. Again, we push that joint forward because I'm trying to get some curvature coming back in there. Now, on that tailbone, that one's the one that your L5, it slipped forward. What we did is we pushed that underneath it and tried to scoop it underneath to stabilize that. Okay? It's going to take us some time to stabilize that. It's not just like a quick fix or anything. But as we get some more and more stability in there, that's going to make you feel a lot better. And with the walking, it's going to push out a lot of the inflammation from that joint. Okay? So that's it for today. Any questions for me? Good. How do you feel so far?
Excited.
Yeah.
I feel, on my back, I feel better.
Yeah?
Already. Yeah, because before I couldn't even sit like this.
Yeah.
It was just really, really bad.
Yeah.
I felt more comfortable like this, and now I can actually sit and be like calm. It doesn't like hurt as bad.
Good. That's an elbow bump right there.